Welcome to this video on creating blueprints for orchestrated care. No one on a construction site builds something complex from their silos and memory. Every trade works from the same set of drawings. In healthcare, however, we often rely on silos of our memory, and patients rarely see the coordinated plans. Today, we explore a better way to manage and coordinate care using AI in a shared architectural approach. A physician may prompt directly from within the EHR. This is how we move from a clinical question to an AI-generated actionable artifact. A physician initiates the process with a natural language prompt. The system routes the task to a governed library, performs deterministic code modifications, and tests the output in a secure sandbox. Finally, the system protects the data and delivers a shared knowledge artifact back to the clinician. Consider the experience of a patient moving through 5 different encounters, from the PCP clinic to an endoscopy to the operating room, the emergency department, and finally oncology. Every encounter is done well, yet each doing their own part. Nobody is building the whole, and the patient never sees a plan. Assembly, not medicine, was the problem. Patient stories today are often built from fragmented memories. The surgeon, the PCP, the care team, and the family all hold different pieces of the plan. But there is no persistently shared set of plans for every condition. This is a structural failure, not a personal one. The fix isn't more blame. It's the missing digital instrument that links it all together. This is the map of the circle of arcs, a digital system where each arc links to detailed, aggregated knowledge at one click. The patient is at the center, surrounded by clinical domains. Your operation, along with its 20 associated services, forms one accountable episode within this system. Every unit lives inside the next, the procedure in the recovery in the arc, and the arc in the patient's life. What keeps your episode connected after you scrub out? What we build with AI are shared knowledge artifacts. These are not simple generative chat replies, but versioned, cited, and revision-controlled documents. Deterministic, calculated. A care plan, risk profile, trajectory simulation, and goal tracker are built once and read by the whole crew. These artifacts ensure everyone sees the same scope and understands the same goals. Our process follows 5 governed AI agents in their stations: ask, route, orchestrate, verify, and deliver. We account for hazards like hallucination and bias by making verification a mandatory station. Deterministic code handles the math, PHI never moves, and a human always signs off before anything is delivered. This is the governed path from start to finish. To route and orchestrate, we treat the process like a construction crew. We use a reasoning model to decompose the question, a clinical extraction model to read the chart, and specific agents to handle tasks like medications or prior authorization. Like a foreman, the assembly agent ensures one-sided, reliable answer. The boundary between our systems and the outside world is a wall, not a suggestion. Protected health information, audit trails, and patient plans stay strictly inside your HIPAA perimeter. Only de-identified knowledge, such as cohort summaries or general insights, is permitted to leave. Public tools do not owe your patient the protection they deserve. In this field demonstration, we see a pre-op planning agent at work. A surgeon simply dictates a request for staging, drug interaction checks, and prior authorization status. The system routes this to the appropriate databases and drafts a plan in seconds. What used to take an afternoon of paperwork can now be prepared in moments. Here is the resulting plan: a staging summary, medication flags, a simulation of treatment outcomes, and automated prior authorization status. The agent does not make the final decision. It assembles the necessary information so that your 15 minutes with the patient can focus on clinical judgment rather than paperwork. This is a working navigator, not a rendering. It allows a surgeon and a patient to see the whole arc of cancer care in one place. It is grounded in the patient's own chart through structured FHIR-linked data and shared at the patient's reading level. This is the full arc of cancer care, designed for the entire crew. Finally, we measure success by goal attainment. By tracking the patient's own stated goals, like returning to the water by fall, against their risk-adjusted trajectory, we can see if we are delivering the right outcomes. Proof of benefit means measuring what the patient achieved, not just the generic curve the population followed. Our library of use cases continues to evolve, adding new governed instruments like post-op surveillance or referral matching. Every new question answered becomes a reusable tool. We strike stale sheets as needed, because subtraction is also a form of governance. The library grows as our drawing set does, sheet by sheet, each one signed. This approach is vital where patients travel for care and hope for connection. Our planning agents help close the distance for rural patients, return hours of documentation time to the clinic, and provide a shared memory across county lines. Access is the strongest argument for surgeon-led adoption, ensuring the best care reaches those who need it most. So, how do we begin? You do not need to commit to an entire platform today. Start small with your CMIO outside the firewall. Use natural language prompts for zero-risk ideation. Then, build together with your team. Prove your work in a secure sandbox, and only deploy code that has been tested against your actual clinical data. Remember, surgeons who leverage AI will move from fragmented encounters into episodes. You will not be replaced by AI. Instead, you will lead the outcomes, the efficiency, and the work-life balance that the rest of the field is still waiting for. Stay the decision maker throughout this process. You are the architect, and it is your signature that brings these plans to life.